Good morning. Welcome to our Let's Talk Parkinson's online event, The Parkinson's Plan. Today's program is brought to you by Parkinson's Community Los Angeles. We are so fortunate to have with us Dr. Ray Dorsey. I've had the pleasure of speaking with Dr. Dorsey, and I know you will find him engaging and informative. I'm Judy Yaris. I serve on the PCLA board as Vice President. For those who don't know us, we are a nonprofit that supports families living with Parkinson's through free education programs like this one, online and in-person support groups, social events, and so much more. If you appreciate our work, please consider making a donation at pcla.org. Your donation is 100% tax deductible, so thank you in advance. We rely on your generosity to help us continue this important work. After the presentation, there will be time for questions. And actually, it's not going to be so much of a formal presentation as we will get right into the conversation at the very beginning. But first, let me tell you about Dr. Dorsey. Dr. Dorsey is the director of the Center for the Brain and the Environment at the Atria Health and Research Institute. The center's mission is to identify the root causes of brain diseases from autism to Alzheimer's so that we can prevent them. With his colleagues, he wrote Ending Parkinson's Disease and the forthcoming The Parkinson's Plan, which details a new path to preventing and treating this terrible disease. Ray previously directed the Center for Health and Technology at the University of Rochester. He chaired the International Huntington Study Group. He led the Movement Disorders Division at Johns Hopkins and consulted for McKinsey Company. And in 2015, he was named a White House Champion for Change for Parkinson's disease. Needless to say, we are very fortunate to have you with us today, Ray. Welcome.
Thank you very much, Judy. Delighted to be with you. And I'm a product of Corona Del Mar High School in Newport Beach, California. So delighted to be connecting with a lot of fellow Southern Californians today.
That's great. We're so happy to have you here. So why don't we start off by telling us a little bit about the Parkinson's Plan?
Thank you very much, Judy. Thank you for all the efforts that you do on behalf of the Parkinson's community in Los Angeles. So my colleague and I, Michael Oken, have written a book called The Parkinson's Plan. It comes out August 19th. You can pre-order it now at pdplan.org or wherever your favorite bookseller is. Michael and I are devoting all of our future proceeds to efforts to prevent and treat the disease. As you know, Parkinson's is one of the world's fastest growing brain disease. Affects 1.2 million Americans, about 12 million people worldwide. And the central thrust of the book is that we think all this is preventable. Most of this is preventable. Most of this is unnecessary. Most of the suffering can be avoided. So in the book, we highlight how chemicals in our food, water, and air, chapter 1's on food, chapter 2's on water, chapter 3's on indoor air, and 4 is on outdoor air, are fueling the rise of this disease. And I think many people with Parkinson's aren't even aware of the exposures that they had. Some people might be aware of exposure to certain pesticides, either from farming. One of my colleagues came out with a study showing that simply living near a golf course is associated with a doubling of risk of Parkinson's disease. But then there are other chemicals, including this chemical called trichloroethylene, widely used in dry cleaning and degreasing, used in consumer production of electronics, used in printing and painting, contaminating scores of sites in LA and Orange County. And associated with a 500% increased risk of Parkinson's disease. And then outdoor air pollution, things you see in LA, the little pieces of dirt and soot you see in the smog. Some of those are so small that they penetrate the nerve responsible for smell, hanging down the upper parts of our nasal passages. And hitchhiking on those little pieces of dirt and soot are toxic metals, lead from gasoline, iron from brakes, platinum from catalytic converters, and they're likely going back into the smell center of our brain and perhaps triggering the initial pathology of Parkinson's disease. So the book's about how we can prevent the disease, how we can learn why the disease begins. It calls to amplify the voices of those affected. And then the last couple of chapters are on about navigating the new frontiers of treatment. And then the book gives you also something called the Parkinson's 25 things that your family members can do to reduce their risk of ever getting this terrible disease. And if you already have the disease, 25 things that might slow the rate of progression of the disease. And these are everyday actions that almost all of us can take in our everyday lives.
Okay, so with all of that said, I know we've been hearing a lot of news about golf courses and environmental factors with that. Could you talk a little bit about that, Ray, since I know so many people may be living in that environment?
Yeah, so we mentioned that certain pesticides, the chemicals that are most strongly linked, or the chemicals that have the most robust evidence for their link to Parkinson's disease, are certain pesticides. Many of these pesticides, many of you know, are neurotoxins. That's how they kill insects. And many of these these pesticides damage the energy-producing parts of cells called the mitochondria. And your brain is only 2% of your body weight, but 30%, 20% of your energy consumption is from your brain. And chemicals that damage these mitochondria have been implicated in genetic forms of Parkinson's disease and in Parkinson's disease more generally. So my colleague, Dr. Brittany Krzyzanowski, who's a geographer at the Baylor Neurological Institute in Phoenix, wanted to know if living near golf courses, which are huge consumers of pesticides, one estimate I saw suggests that golf courses use 80 times as much pesticides as farms do per acre. And she looked at the number of new cases of Parkinson's in Rochester, Minnesota, which keeps close tabs on this. And then she mapped it along with the proximity to golf courses. And she found that individuals who lived in golf courses up to 12 to 14 years before their diagnosis had a 126% increased risk of developing Parkinson's disease.
Wow, that's unbelievable, 126%. So what is one to do if, let's say, you live in a golf course, you can't just pick up and move out tomorrow. What do you suggest for this?
So I think there's a number of things that you can do. One is just call your golf course and see if they can stop using as much pesticides as they can. You know, I can't imagine that golf courses can't get by with 50% less pesticides. Can they get by with using less toxic pesticides? Can they spray less frequently? Can they let you know when they're going to spray? Can you avoid being around when they are spraying, for example? Can you close your windows? Can you get an air purifier to decrease the likelihood of exposure to the toxicants in your neighborhood? If you happen to have a well, get your water from a well near a golf course, I would certainly test it, and I would get a water purifier for your home. And we can discuss more of these when we discuss the Parkinson's 25 things you can do in your everyday life. But there's no reason we need to do this. You know, not only are golf courses high users of pesticides, but it turns out that pesticides are sprayed on kids' schools and playgrounds. You know, we're paying a really, really high cost so we don't have weeds, or so that our golf courses shine green. I think we can make more rational decisions, and that Parkinson's disease need not be the price of playing golf.
Have they isolated specific pesticides? Are there, or is it just pesticides in general?
So likely not all pesticides contribute to Parkinson's disease. The one that's been widely used on golf courses is a pesticide called chlorpyrifos. I'm not sure if it still is. I wouldn't be surprised if it is.
Mhm.
Over half of apples in the United States at one point in time had residues of this pesticide on them. And here, I'll read you something. I'll read it from the book because I'll tell you exactly what it is. I can't find it, but chlorpyrifos, the chemical in the lab, leads to loss of damages the nerve cells that produce dopamine in the brain. And so that one's probably the one that's most strongly linked, that's widely used on golf courses. But it's really kind of hard to sometimes to isolate it. It's kind of like we know that cigarette smoke causes lung cancer. But if you say what chemical within cigarette smoke causes lung cancer, it's really hard to pin it down. I mean, there are chemicals in cigarettes that have been shown to cause cancer, like benzopyrene, but saying which one, it's hard to do. And it's likely that the interaction of multiple pesticides, which are frequently sprayed on golf courses, could be contributing to it. But these questions largely have been under investigated. We haven't systematically studied many of these questions, and I think we're paying a high price for our lack of investigation.
Ray, we have a question from Bob Madoff. He wrote, I have idiopathic form of PD. I'm 66 and grew up in Los Angeles. I carry the LRRK2 gene. Is there a way to determine which gave me the Parkinson's, or does it even matter? Great question, Bob.
Yeah, so what causes Parkinson's disease? So there's this great study called PD gene generation that the Parkinson's Foundation is leading. And they've done genetic testing. Maybe some of you participated. Thank you if you have. Among people with Parkinson's, they've offered free genetic counseling and free genetic testing. And they found that among over 8,000 people tested, only 12.5% of Americans carry a genetic cause or genetic risk factor for the disease. Said another way, 87% of people with Parkinson's have no known genetic cause or no genetic risk factor disease. 87% of Americans, 85% of people, at least around the world, have no known genetic cause or genetic risk factor for the disease. LRRK2 happens to be the most common genetic cause of the disease. About 2 to 3% of individuals carry this genetic mutation. It tends to be more common in certain populations like Ashkenazi Jews, North African Berbers. Individuals who carry this genetic mutation have a lifetime risk of Parkinson's disease, depending on the study, of about 30 to 40%. And so you're really high risk, but the majority of people carrying this mutation actually never develop the disease, suggesting that there have to be other factors that are contributing to it. And I worry about LRRK2 mutations and this chemical called trichloroethylene, which I mentioned earlier. It turns out that the mutation LRRK2 increases the activity of a protein called LRRK2 kinase. Genes are just are instructions for the production of proteins in cells. And it turns out that this chemical also increases the activity of LRRK2 kinase. So you have a chemical, an artificial synthetic chemical used to degrease metal and dry clean clothes that produces the same biological features of the disease as the most common genetic cause. So I get really worried that if I carry a genetic mutation, I am especially susceptible to these environmental risks. Now, these things have not been detailed well. We don't know. We don't know for certain why some people who carry a LRRK2 mutation go on to develop disease and why some don't. Now, does it matter? Yes, it does matter. People who have a LRRK2 mutation tend to have a more favorable prognosis, so we can tell you what to expect for people with Parkinson's. They tend to be less likely to get cognitive impairment, slower rate of progression. People who are exposed to these chemicals like this, not only does this chemical contribute to Parkinson's disease, but it's also known to cause cancer. So if you're exposed to a certain chemical and you've now got Parkinson's disease, when I find this out, I give people guidance around cancer screening and the like. So I think if you know what the cause of the disease is, you're better informed. You can tell what your prognosis is. You can manage these other morbidities. And then two most powerful things. One, if you want to cure Parkinson's, how many of you want to cure Parkinson's?
All of us, double hands on this one.
You first need to know the cause of the disease. So I'll give you an example. Who can name a disease that we can cure where we don't know its cause? Right? It's really hard. So the prerequisite to curing a disease is to find out its cause. I'll give you an example that some of you will remember. Peptic ulcer disease, bleeding ulcers. Do people remember what everyone thought caused bleeding ulcers? I think people will remember, like people said stress, right? High-powered executives getting bleeding ulcers, you need to change job and be less stressful. False. It was due to bacteria. These scientists who figured out that bacteria were causing bleeding ulcers were ridiculed. They're saying bacteria can't possibly live in an acidic environment like the stomach. They even demonstrated the thing by giving themselves, by swallowing the stomach acid of someone with peptic ulcer disease, drinking it, giving themselves peptic ulcer disease, and then curing themselves with an antibiotic. We now cure peptic ulcer disease with an antibiotic. An antibiotic, we cure peptic ulcer disease. Bleeding ulcers used to be a top 10 leading cause of death in the 1960s. And now it's like, I can't remember the last time I even heard of someone dying from a bleeding ulcer. Hepatitis C, the same thing. It used to be called non-hep A, non-hep B. Now we cure it with a course of pills, with tablets to cure hepatitis C. So if we want to cure disease, we need to find out its cause, and that's important for Parkinson's disease. And second, I think even more powerful than curing it is we'd like to never just get the disease in the first place. Wouldn't it be great that your children, that your spouse, your brother, your sister, your friends, your grandchildren never get Parkinson's disease. They live in a world without Parkinson's disease, just like we live in a world largely free of polio. We live in a world largely free of typhus. We live in a world largely free of yellow fever and lots of other diseases which have killed millions of people in the past. We can do that when we identify the cause, and we can get rid of this chemical. So this chemical was banned in 2024, and after a freeze, this ban is likely to go in place over the next 10 years, and that future generations are going to be spared the toxic effects of working with this chemical. So yes, LRRK2 is a genetic cause of disease. Most people who have that mutation actually don't develop the disease. There must be other factors likely in our environment that contribute to it. People with the disease have a slower rate of progression, and knowing why you have the disease can tell you what to expect for your prognosis, what to think other medical conditions to be worried about, how we can cure the disease, and how we can prevent it.
Karen Frank is saying, I live in an area where there is area spraying many months of the year. I don't know what chemicals are used, who is doing the spraying, etc. But I hear the plane in the mornings. What can I do to find out how to decrease my exposure?
Yeah. So I'm going to read you a story. This is a California story. This is in chapter 10. We tell you what the plan is to end Parkinson's. Number 6 is to create pesticide-free schools. In 1998, Robin Sewell dropped off her son Nicholas, a kindergartner, at Sherman Oaks Elementary School in Los Angeles, near where some of you are probably right now. As Nicholas was turning to kiss his mother goodbye, he encountered a cloud of weed killer sprayed from a man in a hazmat suit who'd been treating the school's hedges. Nicholas said, "It tastes terrible," and began to wheeze. He asked his mom if this would happen again. His mom promised it wouldn't. 2 years later, spurred by Sewell's activism, the California legislature passed the Healthy Schools Act. The law requires that all K-12 public schools and licensed child care centers in the state develop programs that minimize the use of chemicals and focus instead on weeding, removing dead plants, and employing traps. The bill bans the use of high-risk pesticides on schools and surrounding parks, and schools that use pesticide must notify parents annually. The right to know law should serve as a model for schools nationally and beyond. If golf courses are going to spray pesticides, if schools are going to use pesticides, if farms are going to use pesticides, I think people, and they have the right to use those pesticides, I think people living, working, and studying near those things have the right to know what those pesticides are, and to take actions to mitigate their risk. I mean, it's crazy that we let this happen. Los Angeles, California, when we realized that it wasn't just smokers who got lung cancer, but secondhand smokers, people who simply were in the bar or in the airplane next to a smoker were at higher risk. We got rid of smoking in bars. We got rid of smoking in public spaces. We got rid of smoking in airplanes, and smoking rates and lung cancer rates peaked in the smoking rates peaked in the 1970s, and lung cancer in the 1990s, and now they're declining. We need to be far more involved and engaged in finding out what's causing it. Research done at UCLA by Dr. Beata Ritz and Kimberly Paul and colleagues showed that simply living or working near where a weed killer called paraquat was sprayed doubled your risk of Parkinson's disease. Simply living or working near where a weed killer called paraquat is sprayed doubles your risk of Parkinson's disease. we're paying a really, really, really high price and no one's covering this cost and the burden's falling on individuals like you. We need to make our voices heard and change the course of using of pesticides, just like Los Angeles and California led the way in getting rid of smoking in public spaces.
Ray, has paraquat been banned at this point, or is it still being used? And I know you see commercials about paraquat all the time now on television.
So not banned. So paraquat is the most toxic weed killer ever created, according to some reports. It kills the weeds that Roundup doesn't. It's so toxic that it's been used to commit homicide and suicide.
Wow.
Dr. Caroline Tanner in California demonstrated over a decade ago that farmers who use paraquat have a 150% increased risk of developing disease. 150% increased risk of developing disease. Researchers, different research groups around the world have all demonstrated that paraquat, when fed to laboratory animals, reproduces the features of the disease, both under the microscope and even the behavior, including a shaking of paws. Turns out the manufacturer did these same experiments in the 1960s, showing that, according to its own researchers, according to reporting from The Guardian, that exposure to paraquat in mice, rats, and rabbits, 3 different mammalian species, reproduces the features of Parkinson's disease. Yet we still use it in the United States, and not only do we use it in increasing amounts. The amount of paraquat used in the United States, according to the U.S. Geological Survey, has more than doubled in the past 5 years, for which data are available. Over 50 countries, including China, have banned the chemical, but the United States does not. The EPA's own website says 1 sip can kill, but paraquat is sprayed in the Central Valley of California all the time. I was just speaking with someone from Parkinson's Association of Northern California, and they call it Parkinson's Alley. The Central Valley of California, they refer to as Parkinson's Valley. It's got among the highest rates of Parkinson's disease in the United States, and it's got among the highest use of paraquat in the country.
You mentioned earlier about air purifiers in the home. Is that something that can actually help?
Yeah, so air purifiers can help. So let me give you guys, since you're all participating, you're getting a sneak preview. So this is the Parkinson's 25. It's in the book. It's not in color in the book. So this is the prettiest view you're going to get. My thanks to Monica from our team. So this is the Parkinson's 25. Here are 25 actions to lower your risk of Parkinson's. For those with the disease, some may even slow progression. Most apply to all of us, regardless of age, sex, disability, or geography. These recommendations may be especially important for those with a family history of Parkinson's, those at genetic risk, for example, the LRRK2 carrier, or those who've been exposed to toxic chemicals. Let's all live longer, healthier lives and say goodbye to Parkinson's. So we did air purifiers. So number 10 is consider air purifiers. Air purifiers are an easy and effective way to lower your risk of disease from indoor air pollution. Air purifiers do range in cost as low as $10 to as high as $1,000, require periodic cleaning and filter changes, and may need to be installed in multiple places depending on the size of the home, school, or workplace. Be sure to use air purifiers with carbon filters designed to remove volatile organic chemicals like TCE. And so I now live in New York City, and we have an air purifier in our living room, and we have an air purifier in our bedroom.
Great. Thank you. That's great. We have a bunch of questions now, so let's go. Tom Baker had asked, what causes hyperhidrosis and what treatments are available?
So hyperhidrosis is increased sweating that's seen in Parkinson's disease. I don't know if I can tell you specifically what it is. As some of you know, there's an autonomic nervous system that operates independently of our conscious control, and that there's autonomic dysfunction in Parkinson's disease, and that might be contributing to it. It turns out that botulinum toxin injections can work and help for people with hyperhidrosis. T-shirts and other things which are easier can help as well.
Okay, thank you. I hope that answered your question, Tom. Pat Kraser has a question here. My husband and I both grew up in different neighborhoods in New Jersey. We remember the bug man going down the street, spraying a fog out the back of his truck. There were no warnings to stay inside. My husband has PD, and we often wonder if that could have contributed to his PD.
Yeah. I think everyone there knows. Let me show you it. Let me see if I can pull something. Yeah. In World War, synthetic man-made pesticides were created largely in World War II, and DDT was the exemplar, and it was used to save millions of people from getting malaria. But after World War II, it was given a hero's welcome, and I think use increased like 20 to 60 fold increase, and it was sprayed indiscriminately. You can see, these pictures of it being sprayed on kids on the beaches. I don't know if that's Los Angeles.
Ugh.
Um, and this is what Rachel Carson was concerned about. So when Rachel Carson wrote Silent Spring in 1962, she wasn't arguing against the use of pesticides. She was arguing against the indiscriminate use of pesticides. And she even wrote in that book that new kinds of illnesses would appear among farmers that would puzzle doctors in the city. And I think one of those new kinds of illnesses is Parkinson's disease. And I think it's been puzzling people because we're not paying close enough attention. In the lab, DDT belongs to a class of pesticides called organochlorines that in the lab damage the dopamine producing nerve cells. In humans, they're fat soluble, so they can get into the brain. And researchers have even found, it was sprayed. That class of pesticides used to be sprayed in Hawaii on the top of pineapples. So, the top, the green leafy part of pineapples. And then the pineapples growers fed that chop to cows, and cows ate that pesticide-laden green leafy part. And I told you that class of pesticides dissolves in fat. So some of you might be thinking, well, it made its way into their milk, and so it did. And then that milk made its way onto the shelves stores in Hawaii, leading to a milk recall. And then my colleague, Dr. Caroline Tanner and Dr. Webster Ross and others looked and found that high milk consumers in Hawaii had higher rates of Parkinson's disease. And they looked at their brain, they had fewer of those dopamine producing nerve cells in the part of the brain affected by Parkinson's called the substantia nigra. And they found the residue of that pesticide sprayed on the pineapples in the brains of people with Parkinson's disease. So yes, I get really, really concerned about pesticides that are getting into our fruit supply. I get really, really concerned about pesticides that we are inhaling and that go through our nose, which might be the front door to our brain.
Okay. Leslie Mason is asking, is the exposure mostly a problem right when it's sprayed, or does it continuously transmit chemicals for days and months after?
These are all great questions. We don't have great research studies on it. Out of every Parkinson's research dollar, only 2 cents is spent on trying to prevent the disease. Homes are sold in Los Angeles for more money than we as a society spend on trying to prevent Parkinson's disease. If that's not a huge indictment, I don't know what is. Homes in California are sold every day for more money than we as a society spend on trying to prevent Parkinson's disease. So the exposure to pesticides does not likely end when it's sprayed. So you can imagine that the spray gets onto the ground. You have your shoes that are then walking on the grass that has the pesticides in it. You bring your shoes into your home, it then gets into your carpet, and then it gets into your indoor air in your home. And so it just spirals on and on for what it is. Now, dose likely matters. So for example, farmers appear to be at higher risk than people who drink water from wells and people who live or work near it. But I don't think the exposure ends when the spraying stops.
Okay, thank you. Bob Madoff again. Some of the newest cutting edge treatments have dealt with stem cells and fecal microbiota transplants. They are not approved by the FDA or not covered by any insurance. They can be very expensive. What are your thoughts?
So, so there was a study of embryonic stem cells. So the idea was to take stem cells, which are undifferentiated cells that they can differentiate into a skin cell, into a liver cell, or into a brain cell, and implant them in the brains of individuals with Parkinson's disease, and implant cells that are going to produce dopamine so you can replace dopamine that's lost. So basically putting little machines, cellular machines back into the brain to replace the dopamine that's lost. By and large, that study didn't work. There are new studies that are looking to do that. If you wanted to participate in a clinical trial, we're appropriately informed of the risks and benefits of doing so, including having surgery done, I think that's reasonable. If you think, I get a little concerned, I think most of my colleagues share this concern about stem cell therapies that are injected into your bloodstream, because how's that stem cell making its way to the brain? The brain is pretty good about restricting access, and it's not just going to let a stem cell just waltz on in. And then how's that stem cell going to form connections to the right parts of the brain that need to have the connections to? And then some people inject it into the spinal fluid. There have been reports that, when you're injecting to your spinal fluid, which is, pristine, it's, generally without cells, it's designed not to have foreign material in it. People have gotten infections and they can get inflammation of their brain infections, and it's called encephalitis, or inflammation of the covering of the brain called meningitis. So I worry about that. Treatment of the gut. So we know people with Parkinson's have different bacteria in their gut than people without Parkinson's. That's well established. And it may be changing that gut flora could change the course of the disease. Study suggested in mice that you could reproduce the features of Parkinson's by transplanting, I think, stool from, either a human with Parkinson's into a mouse and develop the disease. I do not know. I think that the changes in the microbiome in the gut are a consequence, not a proximate cause of the disease. So perhaps not surprising that when you ingest pesticides, ingesting pesticides leads to changes in your gut microbiome. Drinking water contaminated with trichloroethylene leads to changes in your gut microbiome. So I think that many of the chemicals that are linked to the disease lead to changes in the gut microbiome that might also be contributing to the disease, but I think the key precipitating factor is exposure to the toxin. And so I think the goal is to change the toxin, remove the toxin, and stop getting exposed to the chemicals, stop getting exposed to the pesticides on the golf course, stop getting exposed to the pesticides that are being sprayed on top of you, and more so than changing the gut flora. Now, that said, we say in the book that studies to examine changes to the gut microbiome should be done because they could offer promise to those who already have the disease. But I really get worried more about stem cells in terms of the potential adverse effects of it, and perhaps the futility of it a little bit more than changing your gut microbiome.
Okay, thank you. Steve Ebersol, is the filtered water from the fridge just as effective as using a Brita filter?
Yeah, so I used to think all of this. I used to think that the food I ate, the water I drank, and the air I breathed was safe. When we had young kids, my wife said we should buy organic. I poo-pooed it all. In medical school, we were really taught to strongly discount thoughts that chemicals contribute to disease. I no longer have those thoughts. My wife was right. I was wrong. I do not think the food we eat is safe. I do not think the water I drink is safe. And I don't think the air I breathe is safe. That's where I start from. So after we wrote our first book, I put a water filter like from Pura Brita on our kitchen faucet. To do that, it does reduce the exposure to chemicals like pesticides and trichloroethylene. If you look at the regulations, by and large, they almost always lower the level that they thought was safe. They end up reducing it because they ended up being wrong. And in some cases, exposure to some chemicals like lead, for example, there may not be any safe level, especially chronic. So I have a water filter. I use a water filter at home now. You can get a cheap and expensive one from the grocery store. Some of my colleagues talk about reverse osmosis, and that might be thing. I would say the biggest thing, one, I would use water filter. If you have a well, 100% be using a water filter. And then wells aren't regulated by the Safe Drinking Water Act. So they're infrequently tested, and they're rarely tested for pesticides and rarely tested for chemicals like trichloroethylene. So if you have a well or your summer home or whatever home has a well, get it tested for pesticides and trichloroethylene and perchloroethylene, and 100% add a filter to your tap.
Thank you. Catherine Houston is asking, the insecticide you mentioned that is used on golf courses is chloropyrifos. I did not pronounce that correctly. What is the most common insecticide weed killer used on school campuses?
So I put the name of the one on the golf courses. So what's used on school camp? I actually don't know what's used on it. It's so many of you can realize that in medical school we learn lots of medications, and there are literally thousands of different medications. There are hundreds at least of different pesticides, and each of those pesticides have a chemical name, and then they have a brand name. And even though I've been at this for almost 10 years, I don't know all the chemicals that are used in each different setting. I just don't know.
Thank you. Okay, Patty Johnson. The Parkinson's Prevalence Project by PD Foundation identified the Rust Belt zone in the US. Do you have thoughts or updates on this? When it comes to dietary iron, I've heard mixed advice about supplementation for women. And lastly, is there a preferred dietary source? Maybe you could explain this one.
Give me 1 second here. So, if Parkinson's disease were just due to genetics or were random or just due to aging, you would expect that the prevalence of the disease would be relatively homogeneous, or would be just a purely function of where older people live in the United States. But it's not, which suggests that other factors are at play, namely factors in our environment. And so this is work done by Dr. Allison Willis, who has shown us for many years that Parkinson's disease rates vary, and they vary at least twofold, if not more, in the United States. So this on the right is her study showing the incidence of Parkinson's disease. Incidences in black, like the Central Valley of California, where we're talking where paraquat is sprayed, or in the Rust Belt are higher. And so I just pulled a map of particulate matter, and I'll let you decide. So in red are the high levels of particulate matter, blue are the low areas. And so when I look at this map, I go, huh. I get a little concerned that the Rust Belt has higher levels of particulate matter in Central Valley of California, Los Angeles, and you see higher rates of Parkinson's disease in Los Angeles, Central Valley of California, and in the Rust Belt. And if you put the map of paraquat, you would see something disturbingly similar. And if you looked at releases of trichloroethylene into the environment, you would see something similar. So this is what I get concerned about. Now, I mentioned lead hitchhikes or carried into the brain, likely by the small particulate matter. Fortunately, we've got rid of lead in gasoline and lead in paint. Lead levels in children, almost everyone here had unsafe levels of lead in their blood, including people like me. Lead levels today are 95% lower in kids than they were when I was a child. 95% lower. Kids today are smarter because they have less lead in their bodies, and because we got rid of lead in paint and lead in gasoline. The world did not spin off its axis. People still able to drive cars in California and paint schools without lead. Now, lead consumption, much less studied to my knowledge in Parkinson's disease. I think the brain does a pretty good job of keeping, the brain has something called the blood-brain barrier, which keeps toxic metals out or strictly regulates the concentration of those. I think the nose is the weak point here. The nose is like the front door of the brain, and I think these particles are going through the nerve responsible for smell and going back to the smell center and bypassing the blood-brain barrier in that way. Some of you, I think most people think of Parkinson's disease as a brain disease. In 2003, a really smart German pathologist, Heiko Brack, said Parkinson's disease doesn't begin in the brain. Parkinson's disease, he says, the pathology of Parkinson's disease, the misfolded alpha-synuclein, the Lewy bodies, they're first found in either the smell center of the brain, called the olfactory bulb, or in the nerve that goes to the gut, called the vagus nerve. And then he thought that Parkinson's might be due to neural invasion. He thought perhaps from a virus, thinking like polio was a virus that, gets into us through our gut and then goes back and affects the nervous system. And in 2019, my colleague, Dr. Per Borghammer, said that there are two forms of Parkinson's disease: a brain first or nose first form of the disease, where the pathology begins in the nose, and then a body or gut form of the disease, where it first begins in the gut. And I said, I read his stuff, I found it very compelling. And then I sent him an email and said, well, how does this tie in with, does this tie in well with toxicants that we inhale? Like think air pollution or certain pesticides would lead to a nose or brain first form of the disease, or toxins that we ingest, swallow, eat, like contaminated water, that would lead to a body or gut first form of the disease. So he liked it. We wrote a paper on it, and that's the model I think about for Parkinson's disease. I'll show you a figure. I think I can show you a figure from our book. And then some of you also know the earliest features of the disease are loss of smell, which happens years before the disease, before the tremor, for example, starts. And some of you know another earlier feature of the disease is constipation. So I think, for example, constipation might be happening first in individuals who got exposed through their gut, and then other people got exposed to perhaps got it, loss of smell might be starting for those who got it from their inhaling it.
Okay.
So this is what I think: environmental toxins that are either inhaled lead to a brain first form of Parkinson's disease, versus an environmental toxin, say a pesticide that's ingested, leads to a body or gut first form of the disease. Now this needs to be proven. This is, this is like a model, right? It's imperfect, it's overly simplified, and this is even more simple than my colleagues have put it. But I think this is a way for thinking about what's causing Parkinson's disease in most individuals.
Okay. Thank you. Angela Chang is asking, should we try to eat organic food as much as possible?
100%. So number one recommendation for Parkinson's 25 is wash your produce, even your organic ones. Pesticides have contaminated our food supply. Remnants of pesticides are found in 20% of common foods. Organic produce, dairy products, and meat can reduce exposure, but can still have unsafe residues of pesticides. So wash your produce at least with water, and consider simple vegetable washes, vinegar, or salt solutions too. So yeah, and especially I get really concerned about pesticides being concentrated or magnified as they go up the food chain. So like dairy products and meat, if I had Parkinson's disease, I would be doing organic.
Okay, thank you so much. Bob Siegel is asking, may be unfair to ask a doctor, but when the EPA is dialing back chemical regulation and dismantling their science and research arm, how do we implement these fixes, which go well beyond individual action?
Yeah, we spent time thinking about this. So chapter 10 is actually our plan. So here's what we call the Parkinson's prevention pyramid. So what are you as individuals, what can you do? And we give you the Parkinson's 25. What can you do in your community? We heard about like give citizens the right to know. So if they're spraying pesticides on your golf course, if the crop dusters being sprayed, you should have the right to know what's being sprayed. We can create pesticide-free schools. We can build it and live away from freeways. We talked about a major problem in Los Angeles. We can develop organic golf courses. These things are not within our individual control, but certainly within our community control. And then what can we do societal level? We can measure the disease. Like we don't have even really good, if you can believe it, really good data on how many people actually have Parkinson's disease. We have really poor data on how many new cases of Parkinson's disease are. Dr. Willis and colleagues did a study estimating that our previous estimate for the number of new cases of Parkinson's disease, 60,000 in the US per year, was off by 50%. Off by 50%. We have a disease that affects 1.2 million Americans that costs society $50 billion a year, costs Medicare $25 billion a year, and we don't even know how many new people are getting diagnosed with the disease. We need to ban these dangerous chemicals, and that's, the EPA. But, California can lead, and California has led in getting rid of chemicals like lead, for example, reducing lead exposures. Adopt the precautionary principle. Basically says that just before medicine is approved in the United States, it needs to be proved to be safe and effective. But chemicals, in order to get a chemical removed, it's incumbent on people like you and scientists and regulators to demonstrate it's unsafe. We should have switch it and just say that before a chemical pesticide is introduced, it needs to be shown that it's safe. And we need to stop subsidizing the use of pesticides. It turns out that we spend at least $15 billion a year in the United States on agricultural subsidies. 99% of those agricultural subsidies go to conventional farming. That conventional is a euphemism for farming that uses pesticides. The two crops that are most subsidized receive the most subsidies are corn and soybeans. The two crops sprayed the most in the United States with paraquat are corn and soybeans. So we're taking your tax dollars, subsidizing the use of paraquat on the use of corn and soybeans so we can contribute to Parkinson's disease in your community.
We have a few more questions, and I want to try to get to everyone here. So we have Estella Ben Simon. I was recently diagnosed with PD, and I also have small cell lung cancer, stage 4. Does PD have different stages? Are there ways of slowing down its development? Is remission possible?
So one, sorry to hear about the condition. Two, it does have stages. The most commonly used stage was developed by a woman, Margaret Hone, who was a professor at Columbia University, who in 1967 wrote a staging system with Dr. Melvin Yar. Stage 1 is when the disease just affects one side of the body. Stage 2, like for example, you just have a tremor in one hand. Stage 2 is when you have slowness in movement on both sides of the body. Stage 3 is when you have impairment and balance. Some of you have been a Parkinson's specialist. They pulled you, tested your balance by pulling on you. If you can't maintain your balance, that's stage 3. Stage 4 is you need an assistive device to walk with it. And stage 5 is that you can't walk. So that's the staging. Can you slow the disease? Can you reverse disease? I don't know if we can reverse the disease yet. I'm aware of any evidence that we can. Slow disease, I think yes. So there have been, and that's what the Parkinson's 25 is. So for example, even among people who already have Parkinson's disease, they already have Parkinson's, so they're like you, people who are exposed to high levels of air pollution have an increased risk of hospitalization of Parkinson's disease, suggesting that air pollution is exacerbating their Parkinson's disease. The analogy I like to use is if you're a smoker and you're diagnosed with lung cancer, what's the first thing the doctor's going to tell you to do?
Stop smoking.
Stop smoking. And if you're a farmer with Parkinson's disease, what should be the first thing the doctor tells you to do? Stop getting exposed to toxic pesticides. And I don't think we've done that. I think it's a disservice that's fallen on me, and that's why Michael and I have tried to rectify it, is that we should be giving you actions that you can take to slow the rate of the disease. And some of you know about the benefits of exercise, but we give you 25, and we give you, in pretty good detail what you can do to slow the disease. And I forgot the third part of the question was?
Is remission possible?
Remission. So I wish, I just haven't seen it. I'll tell you what I have seen. I've seen this a lot. I've seen people exercise so much that I tell patients that when I see them, they should exercise at least an hour a day, assuming they have no reason that they can't. And if I had Parkinson's, I would exercise at least 2 hours a day. I've seen people come off medications. I've seen people stop taking medications with Parkinson's because they've exercised so much. I see all the time that people need less medications or are able to stabilize their dose of medications with exercise. Peter Attia, many of you know, is a big podcaster, and he says that for neurodegenerative diseases, exercise is the best treatment. Full stop. So I think there are lots of things that we can do. If you look under the microscope, with this reverse the damage that's been done? I would think not. Would it slow the rate of progression of ongoing damage? I think yes. And so I think there's a lot that we can do to slow the rate of progression of the disease.
Okay. Bruce Pelkey, I have a triple whammy, raised in the Rust Belt, living in the California Central Valley, and a family history on both sides. Do you know of any diet to cleanse heavy metals pollutants?
So no, Mediterranean diet, which we discuss in the book, low in animal products, less exposure to those toxins as pesticides that get concentrated at the food train, high in fruits and vegetables, wash them, organic, the best evidence we have for it.
Okay. Patty Johnson, should iron deficient women with PD supplement with iron pills?
I don't think there's any harm in doing that. I would think I'd be more concerned about being iron deficient than I would be worried about the Parkinson's. I'd figure out why I'm iron deficient though first, and do I have a small bleed or something like that?
Okay, there's two good ones here. Okay, Bob Madoff, it looks like I'll be moving from LA to Pacific Northwest due to your map. Most people with Parkinson's have problems with sleep, fragmented sleep. Getting a good night's sleep is very important. Have given in and started taking trazodone. Do you have any new suggestions to help PD patients sleep through the night that doesn't require a prescription?
Yeah, so I try a lot. Sleep hygiene, going to bed at the same time every day, waking up about the same time every day, closing off light into your room, avoiding eating or drinking before you go to bed. All those kinds of things can help. If you get daytime sleepiness during the day, a brief 30 to 45-minute nap can be good. And remember, as you get older, you need less sleep than you do when you're younger. So if you're getting 6 hours of sleep, that's probably not too bad.
Okay, two really good ones here. Should we take a probiotic? And then I'm going to wrap, that's from Tom Baker, and I'm going to wrap Donna's into this one too, Donna Flint. I always drink the tap water at a restaurant. Should I bring water from home? Two,
Uh,
I think those are two really practical questions that
I
could,
don't know the answer for probiotic. I would think it'd be unlikely to be harmful. Tap water from restaurants, there's a practical, just a pragmatic thing to it. I probably wouldn't, that wouldn't be like on my top 10 concerns. Um, I think there are lots of other things that I would do before I would worry about the tap water in restaurants. But I keep saying these things people usually ask me about dry cleaning their clothes and stuff, and then someone tells me that they're in a restaurant every day and they're a waitress and they're drinking the tap water every day for 30 years, and then what happens. So
okay, thank you. Is it Gia Forlani? Recently, a letter by Totsunue et al. Raised doubts about the brain first versus body first hypothesis, suggesting a major complex involvement of the heart's nerve too. Could you comment on this, please? Do you predict any new treatment being developed along it?
yeah, I think I know which study you're talking about. That was looking back at doctors' notes to try to determine if the brain first and body first models comported with doctors' notes. Anyone who's read doctors' notes know that they aren't the most pretty things in the world. And unless you were systematically trying to do this, are you dating when they develop constipation relative to when they're developing tremor and other symptoms? I think it's hard to do. I really am moved by the body and brain first forms of the disease. Some people know, like, you get constipation, then you get problems with lightheadedness, then you get problems with sleep disturbances, then you get more symmetric Parkinson's, and then you get dementia. I like it, but I'm sure we've oversimplified it. I'm sure it can be improved upon. And then what was the second part of that question?
I think that was it. Are there treatments being developed?
Uh, Not yet. This is more now like understanding. Not yet, but the closer we get to the cause, you can imagine if you identify the cause, then you can create lab animals that replicate that disease, and then you can test out new therapies on them. I think we should be testing out new therapies, for example, on animals exposed to trichloroethylene, to see if what we can do to find out new treatments.
Barry Yablo, can you unmute yourself? He may not be able to type into the chat. He has a question. Okay, Barry.
What besides exercise has been shown to slow down the progression, if anything?
I think ongoing exposure to these toxins. So I think the reasons why some people have a slower rate of progression and some have a faster, this is what I think, is some people are having ongoing exposure to the toxins that contributed to their disease in the first place, and some aren't. Some are still drinking the well water that might have contributed to their Parkinson's, for example. Some are still getting high exposure to high levels of air pollution because of where they live or where they work. So exercise, yes, and then I worry about ongoing exposure to toxins that's got to stop, and be especially stop for people who have the disease.
Thank you.
Thank you. Thank you so much, Ray. I want to thank everyone for joining us. I know you may have more questions. Hopefully, we'll bring him back another time and we'll get to go into another area. I just want to let you all know that there is a lot happening with PCLA. On August 14th, it's part one of the Moving Forward series, Improving Speech, Swallowing, and Cognition. You're going to meet three incredible speech pathologists over the next 3 months, and you will learn a lot. These are important areas for you. And last but not least, if you enjoyed today's program, please visit pcla.org and make your donation today. By donating to PCLA, you can join us in our mission to improve the lives of families in our community that are living with Parkinson's. You can find our contact information at the bottom of the screen. PCLA is a nonprofit and all donations are tax deductible. Ray, as always, it has been terrifying and informative. It is so wonderful that we have you out there championing for us and trying to bring new ways of looking at how we can make our lives better with Parkinson's or to prevent it in the future. Thank you again. I'm so
Thank you.
grateful for your time. And
Thank
thank you
you.
all for attending and being
One
part of
thing,
it.
plug, if you have a chance, if you can afford the book, please buy the book. The more people buy the book, the more attention we get, the sooner we get rid of these chemicals in our food, water, and air, the sooner we create a world without Parkinson's disease.
Right.
As a neurologist, I can't think of a better gift than getting rid of a neurological disease. I can't think of a better gift for our kids and grandchildren than a world
Absolutely.
without
I
Parkinson's.
think it's something that everyone should buy, and PCLA will also have some copies available when it comes out August 19th.
And it's
So
available
we
on
are very
Amazon.
excited for you. Thank you so much, Ray. It was a pleasure. Thank you
Thanks.
all for joining us.